and welcome back to Health Serum. Today we're going to discuss the health issue of high blood pressure, also known as hypertension. The two main risk factors for hypertension is heart disease and stroke. Usually the blood pressure is taken in the upper arm area, which we call the brachial area, because that is the highest place of pressure in the human body. There are two types of hypertension, one being primary hypertension, the other being secondary hypertension. Primary hypertension is usually due to no medical reason at all. And some of those reasons are old age, obesity, salt-heavy diet, low potassium levels, and a sedentary lifestyle, meaning a lifestyle where you don't move a lot, immobile, sit around a lot, couch potato, don't go for walks, don't exercise, etc. All of these can be prevented, except for old age, of course. We can't help that. However, the other ones can be prevented. Again, we always want to include diet and exercise for all medical issues of primary preventative care. The second type of hypertension is secondary hypertension. This type of hypertension is caused by medical reasons, primarily the kidney or renal blood flow interruption in the body, such as atherosclerosis, which is a buildup of fat and cholesterol in the artery wall, which makes it thickens the walls of the artery. Vasculitis, inflammation of blood vessels, which also thickens the blood vessel walls and also cuts off vital blood supply to the body. Aortic dissection, which is a tear in the artery of the blood vessels branching off of the heart. Very serious. The primary, as I stated, effects of blood pressure is in the kidney. The kidney is important for blood pressure regulation because when it's not enough blood flow in the kidney creates renin, and renin creates water retention, and water retention increases pressure, which increases fluid volume in the blood, in the vessels, and that's never good, which creates high blood pressure, swelling, heart failure, etc. Some of the other secondary reasons of hypertension includes fibromuscular dysplasia, which usually affects young women, and again, artery thickening. Tumor, which causes aldosterone, right? Excess aldosterone, which is a hormone, and also includes fluid retention. Hypertension crises is when your blood pressure is above 180 to 120. Now, when the hypertension is in crises, there's two categories. Urgency hypertensive crises is when none of the end organs are damaged, and the end organs are the brain, the kidney, the heart, and the lungs. Emergency hypertension crises is when there is damage to the end organs. Some of the side effects of that would be confusion, drowsiness, chest pain, and breathlessness. Treatment for hypertension, as for many other medical issues, primarily diet and exercise, as well as stress relief. Secondary would be hypertension medication, which are called antihypertensives, which is a place that a person doesn't have to be at if they learn to manage the preventative measures of this particular disease. Now, what I would like to do at this point is go over the different levels of blood pressure, the levels of normal blood pressure, elevated blood pressure, stage 1, stage 2. Now, the thing about blood pressure, it also carries over into a lot of other diseases like diabetes and heart failure. So a lot of these healthcare issues or health issues coincide with each other because of the improper balance in our body. So let's look at the measurements for blood pressure. Normal blood pressure is a systolic, which is the number on the top, which indicates the pressure against the artery wall when the heart is contracting, and it's called a systolic number. So a systolic number on the top of 120 and less than 120, and a diastolic, which is the number on the bottom, less than 80. Diastolic is a measurement of the pressure against the artery wall when the heart is relaxing or at rest. Elevated blood pressure is between 120 to 129 systolic and below 80 diastolic, give or take. Stage 1 hypertension is 130 to 139 systolic and 80 to 89 diastolic. It is also an indication of the possibility of being pre-diabetic. Stage 2 hypertension is above 140 systolic and above 90 diastolic. And these ranges include diabetic indications as well. Now, let's talk about diet. We always talk about diet and exercise, as we know, get active, some type of activity. I don't care if it's walking, swimming, jumping jacks, exercise 30 minutes per day is always good, or more time, several days a week. Exercise is good for the body. It helps heal the body, keeps the body regulated. It manages blood pressure. It manages insulin levels, as we have learned, and a lot of other things, which prevent us from taking what? Medication, which includes side effects that we really don't need. Okay, carrying on. Hypertension. So let's review dietary. Dietary, we should avoid excessive salt, because salt lowers potassium that decreases blood pressure, which assists in hypertension. 2, insulin resistance. Watch out for insulin resistance. Again, diabetic. Insulin resistance blocks potassium, which increases sodium and increases blood pressure. The solution to this is to increase potassium, right, which reduces blood pressure, reduce sugar and salt, which also reduces blood pressure, and implement intermittent fasting, because that has been shown to be very effective with blood pressure management. I would like to also give you 8 high potassium foods, because potassium decreases blood pressure. Number 1 is avocados. 1/2 of avocado is 345 milligrams of potassium. Number 2 is potatoes, either baked or steamed, not French fries, guys, equals 740 milligrams of potassium. And then you have fruits such as bananas, cantaloupe, and kiwi, which are high in potassium. Bananas being one of the primary high fruits in potassium, which could decrease blood pressure. 2 bananas will decrease blood pressure by 10%. We want to also indicate fatty fish like salmon, tuna, and mackerel fish. Yogurt, fat-free milk also decreases blood pressure. Leafy greens as kale, spinach, collard greens, and such. Unsalted seeds without salt, because the salt in seeds would imbalance the potassium level. Unsalted seeds contain potassium and magnesium, which also assists with lowering the blood pressure. Beans and lentils also include potassium and magnesium, also assist with decreasing blood pressure. So thank you for joining me, guys, and I hope that's been helpful. If you have any comments, concern, or additions, please subscribe and comment below. See you next time. Stay healthy, stay strong, and stay aware of your body. Let's all get healthy together.